Hi, Newbie's Nurse Ruthie here. So I'm sure by now you guys have heard about Miss Rachel Tussey. She was a TikTok star who went for a mommy makeover and did not make it. When I first heard about this case, it was a TikTok video that Miss Rachel Tussey's husband made on her account. He's taking you through the day. He says that he was waiting, I believe, in the parking lot. And the surgery took hours, and they told him he could go in. So he goes in, and his wife hears his voice in the surgery center and starts calling him over. So to me, that tells me she's alert, she's oriented, she has a clear airway. He says that they were talking, and then all of a sudden she turned completely white. And he said that there was no sense of urgency. He's like, I'm just a construction worker. He said that they put the bag valve mask on and there was no seal. He's just a construction worker and he knows that you got to put a seal on that thing. He says that they came over, they pumped it twice, and then they walked away. She got on the phone, comes back, pumped it twice, and walked away. It was like, what? What? Like, so, and then like the last scene is him in the ICU with his wife, and she's in the back intubated. So sad. She was considered brain dead. So she's in hospice care. Now the 911 call has come out of the nurse calling because she finally decided to call 911. Because I guess this nurse called the doctor. The doctor's like, call 911 right now, like the song. Because first of all, the doctor had already gone for the day. The anesthesiologist has already gone for the day. I'm sure this is not the way it's supposed to be, but I don't work there, so I don't know their protocols. I don't work at a surgery center. Apparently, this nurse had given like 150 mics of fentanyl. It's at zero point 0.5 of Dilaudid with the news that I saw now, but I felt like it was more than that. Because I remember when I first heard about it, I was like, damn, that's a lot of medications. But see, I don't work in a surgery center, but damn, that's a lot. So apparently the surgeon agreed it was a lot. Anyways, he's like, call 911. He drives back. He's like, I need a stethoscope. These bitches don't got no stethoscope. You're a nurse. How are you assessing lung sounds without a stethoscope? But anyways, I'm just so heated because this could happen to anybody. And the whole purpose that I'm making this video is because I don't want you to assume. Because when you listen, I wish I would have recorded myself listening to the 911 call of this nurse calling 911. I was like, get to the point. Like, she gave the address like 3 times. They're like, oh, no, this is the juvenile. No. I'm like, oh, my God. Look, this lady, finally, the 911 operator is like, is the patient breathing? And she was like, no. So I am assuming that the 911 operator, because the girl says she's a nurse, knew that she's supposed to be doing CPR. I would be assuming this. But this is what this whole lesson is about. Do not assume that just because somebody is a healthcare worker that they know what to do. You know, you get a patient, let's say they're a doctor, they're a nurse, they're a tech, they're being discharged with JP drain. And you're like, oh, you know how to do it. They may not know how to do it. They don't know how to empty this thing. They don't know how to strip it. They don't know anything. Just because they're a healthcare provider, do not assume they know what to do. I swear, this nurse, I felt like she thought she was talking to her grandma. She was like, all right, I'll see y'all soon. What? Girl, hand that phone. Do them chest compressions. What are you doing? Get the security guard in there to do chest compressions. What are you doing? Like, just the perception of the 911 call alone, that's all they got to play. In the courtroom is the 911 call. The husband doesn't have to open his mouth. They're going to win the case. Everyone in that courtroom is going to be thinking, what if that was me on the table? Would I want her to be like, oh, no, I need an ambulance now. That's what I want to hear. And then get this right. So I guess the surgeon is now suing the surgery center. And he says that when he looked over his documentation, someone had changed the documentation. I guess they changed the dosage amounts of what was given. And so now he's like, nope. He's suing them. And one of the nurses got fired, but then she got rehired because she knew somebody there. She's a family member of somebody. Like, this is crazy. This is all too much drama, way too much drama. So listen, the moral of this whole video is do not assume because they are a healthcare provider that they know what to do. Number 1. Number 2, research where the you are getting your surgeries done. Here in Florida, they got all kinds of documentaries on how they have these strip mall plastic surgery places. Like, this is in the middle of the mall. And people go there, they get their surgeries. And if something happens, the person, they shut it down. They move the surgery center to another strip mall. They change the name. So be careful where you go. Research that because Google is not going to show you the real reviews. You need to go to like the board of health. You need to see what kind of complaints they got there. And another lesson, just because you can give the medicine does not mean you have to give the medicine. I have had patients that they've been given Dilaudid, Percocet, fentanyl, and they're like, I'm in pain still. I understand you're in pain. Your pain is less than when you first came in. I'd rather you be in some pain because all the pain is not going to go away. I'd rather you be in some pain than not breathing. I'm not saying not to manage your pain, but part of your job is to be safe. If they are slurring their words, if their vitals are not good. Also, if they're an elderly patient, that medication is going to hit them like that all at once. All right, newbies. Remember, treat people how you want to be treated because what you put into this world is what you're going to get back. Have a great shift.